So this is a study of Rosenhan. If you look at just Brad Pitt there, he's asking the question, when you're insane, do you know that you are insane? What Rosenhan did was ask a further question. So we've already looked at things like the DSM and how we diagnose mental illness. But there were some questions in the 1960s and 1970s about whether that is actually a feasible way of doing it. And I've got a short video clip here I'm going to quickly show you before I move on and talk a bit more.
There's always been madness, but it wasn't until the 19th century that it came to be seen as a disease, to be managed by a new group of experts, psychiatrists. New asylums were built, their walls and bars marking the supposedly clear-cut boundary between the sane and the insane. But in 1887, an enterprising journalist called Elizabeth Cochrane, who wrote under the name of Nellie Bly, challenged this. Nellie Bly was on a mission to test out psychiatry. So what she did, she checked into a boarding house and she started pulling strange faces and tugging her hair out and saying everyone around her was crazy. And sure enough, it wasn't long before two doctors had her shipped off to the woman's lunatic asylum in New York. Once inside, she behaved perfectly normally, but it made no difference. As she later wrote, the saner I acted, the crazier they thought I was. Her articles and her book, 10 Days in a Madhouse, showed just how easy it had been to fool the doctors, and just how terrible conditions were inside the asylum. 85 years later, a clinical psychologist called David Rosenhan would do much the same thing. The 1960s was a time of social and cultural revolution. Established ideas, institutions and professions were questioned, and one of them was psychiatry.
The 1970s were a very turbulent period for psychiatry. At the time, there were a group of psychiatrists, well, in the 1960s anyway, and going through to the 70s, there were a group of psychiatrists who actually badged themselves as anti-psychiatrists.
The medical model saying that this is a largely physical thing, that people have become mentally ill, and the anti-psychiatry movement was saying that perhaps we should see this in a different way.
Thomas Satz argued that psychiatry was a pseudoscience, and the very idea of mental illness was a myth. Irving Goffman suggested that just being in a mental hospital was enough to drive people insane, and R.D. Laing claimed that what psychiatry said was mental illness was just a rational response to an insane world.
What bound them together was objection, a horror at the way that psychiatry was being practiced. In those days, people were largely just incarcerated in big hospitals. I mean, we used to call them loony bins, and in a way, although it's a pejorative, it was like a dustbin for people, really. It's horrible.
It's a space where you can meet with her, where she's not going to be frightened.
R.D. Laing was the most famous of these anti-psychiatrists. It was while listening to one of Laing's lectures that David Rosenhan wondered if there might be a way of actually testing the reliability of psychiatric diagnoses. Can we really tell the sane from the insane?
So as it said in that video, R.D. Laing was a big anti-psychiatrist. He was a Scottish philosopher and researcher who thought that our ideas of mental illness, much like Thomas Szasz did when we talk about the DSM, were just made up and we couldn't actually tell if people were insane or not. Rosenhan wanted to set out and test this. So he did a study very similar to what the journalist had done in that video. So there were 3 separate studies, and these are the aims of them. Study 1, to investigate if sane people who present themselves at a psychiatric hospital will be diagnosed as being insane. Study 2, to see if the tendency towards diagnosing the sane as insane could be reversed if we could get doctors to take people who had real mental illnesses and say that they didn't have mental illnesses. And study 3 was a control task to look at the behaviours that the doctors and nurses had shown in the first 2 studies. That'll make a lot more sense when we get onto it. Overall, they're really there to test the reliability and validity of psychiatric illness diagnosis. So Rosenhan got 8 pseudo-patients. A pseudo-patient is just their word in this case for a confederate. they got 8 Confederates who were going to pretend to have mental illness. There were 3 psychologists, 1 psychiatrist, who was Rosenhan himself, he went into the hospitals, 1 graduate, 1 paediatrician, 1 painter and 1 housewife. We try to keep all of their kind of background details as close to real for their lives as we could, only changing the names of kind of the psychologists and Rosenhan himself. So these patients were sent to 12 different hospitals across 5 different states. We try to vary the hospitals, so some were modern, some were old, some were well staffed, some were poorly staffed, and one of them was private. And remember, these 12 hospitals and the staff in them are really the sample. Yeah, if we're talking about the sample of this and if it's representative and things, the sample is the hospitals, not the pseudo patients. And the pseudo patients are, remember, Confederates in this experiment. And we were seeing how well doctors could diagnose these patients. So again, all of them gave real names apart from the psychology, those in the psychology industry. So they turned up at the hospital and gave their normal backstory, but they said that they were hearing a voice. This voice was a muffled voice in their head. It was a man's voice, and it was saying words like thud and hollow and empty. These are 3 key words to kind of describe the voice. It said thud, hollow and empty. These words were specifically chosen because they allegedly arose from painful concerns about the perceived meaninglessness of one's life. Really were there to kind of push people into thinking that these patients had problems. All of the pseudo patients were admitted into the psychiatric hospital. All of them diagnosed with schizophrenia, apart from 1 who was diagnosed with manic depressive disorder, which is now called bipolar disorder. This could be a point we could make about the reliability of diagnosis straight away. Not everyone was diagnosed with the same illness, but the majority were. As soon as they were admitted into the hospital, they were told to start behaving exactly as they normally would do. Don't mention any of the voices anymore. As far as the say that the voices had stopped, and begin to act as you would just in a normal situation. Do not act insane. Don't play up to it. Anything like that. Rosenhan wanted to know how soon or how quickly the doctors would realise that these patients were sane and have them released from the hospital. Obviously this is a video, so we can't actually have any guesses, but just think what you would think. How quickly do you think doctors would realise that people are not insane if they're acting totally normally? The answer Rosenhan found was that it took between 7 and 52 days for patients to be released, with an average of 19. Yeah, so 1 patient at least stayed in this hospital for 52 days, nearly 3 months, before a doctor was confident that he was not insane. I say he's confident that he was not insane. What actually happened was all of the patients were released with schizophrenia in remission. So there was 8 pseudo patients who went into the hospital, obviously 12 different times, because there was 12 hospitals in total. And in these 12 situations, they were released eventually. But the doctors still thought they had schizophrenia. Yeah, they were diagnosed as schizophrenia in remission, which means that you're schizophrenic, but you're just not showing any symptoms now. Yeah, they didn't realise that these patients were never ill, which again calls into question how well we can actually diagnose mental illness. So a few other things happened. There's a few other important results to note from these experiments, things that the pseudo patients noticed themselves. The label of schizophrenia is sometimes referred to as being a sticky label. Yeah. Once you are diagnosed with schizophrenic, that changes the way people look at you. That changes their view of you and your behaviour. So normal behaviours that the patients did, like waiting outside the cafeteria for lunch, writing in the diaries, and walking around the corridors because there was literally nothing to do, were changed to being about a symptom. So waiting outside the cafeteria for lunch, they were orally inquisitive. Yeah, they had too much focus on eating and they had a problem with that. Patients engage in pathological writing behaviour because they were keeping notes in a diary, and so on. If the patient reported varying closeness with his parents when they were having therapy and things, if they basically said like they weren't massively close to the parents, it was said to have considerable ambivalence to close relationships. Again, a behaviour which is perfectly normal, being seen as a mental illness symptom. Other things, of the 2,100 pills that were given to the pseudo patients, only 2 were actually swallowed. The doctors and nurses were not taking sufficient care of these patients, and the majority of the pills were not being taken. The pseudo patients reported a feeling of powerlessness. Their freedom of movement was restricted. They weren't allowed to go outside a lot of the time. They couldn't initiate contact with the nurses and the doctors. The toilets didn't have doors on them, so they were having to urinate and defecate with other people watching them and things like that. Nurses stayed off the wards about 90% of the time. They stayed in like their offices, or the cage as it's referred to. And each real patient, the pseudo patient, spent less than 7 minutes per day with psychiatric staff. So of the 24 hours, only 7 minutes of the day was spent actually getting help from doctors and nurses. So the big question was, did no one suspect that these were not real patients? And in truth, they did. Some people did suspect. The actual patients themselves. So of the 118 patients who were in the hospitals with the pseudo patients, 35 of them told them that they knew they weren't really mentally ill, that they were pretending to be mentally ill. So this caused a lot of problem when Rosenhan published his findings. He came out and said like doctors couldn't do their jobs properly, and a lot of doctors complained, and rightly so in some degrees. This is an evaluation point indeed of the experiment. The doctor is there to help patients who turn up and say that they are ill. It's not their job to try and spot if somebody's lying to them. If you turn up and say you've got the symptoms of schizophrenia, then how else are they really meant to know without taking you into the hospital? So they said that Rosenhan's test was unfair because they weren't aware that they should be looking for people. So what Rosenhan said was, fair enough, we'll do another study. So what I want to do is send, over the next 3 months, some pseudo patients to your hospitals. He told like a number of hospitals. I'm going to send some pseudo patients to your hospitals, and I want you to report to me who is mentally ill and who is not. And what the doctors had to do, staff had to rate new patients, so people who turned up at the hospital complaining of symptoms of illness, on a scale of 1 to 10. How likely are they to be a fraud? They still had to admit them into the hospital, because you want to be safe and make sure that you're doing that. They still had to be admitted into the hospital, but you had to say whether you think they were faking it or not. So there's 193 patients who were assessed. 193 people turned up on their doorstep. 41 were rated as pseudo patients by staff, 23 by a psychiatrist, and 19 were rated as pseudo patients by both of those. So a large number were said to have thought to be pseudo patients. In truth, none of them were. Rosenhan didn't send anyone. So these were all real patients, people who wanted help, and the doctors were basically saying that they were not mentally ill. So we've discovered straight away in the first experiment that we can't tell when people are sane, and in the second experiment we can't tell when people were insane. So Rosenhan concluded that we do not have any of these sort of abilities to diagnose people as being mentally ill or not. And the depersonalization and powerlessness was bad for people, especially as the label of being insane is a sticky one that will follow people for the rest of their lives. So then we get on to the last study, which is a very quick one. Basically, Rosenhan wanted to see if the interactions that the patients had with doctors in the hospital were anything like the sort of interaction people would have outside of them. So in 4 of the hospitals, pseudo patients had approached members of staff and asked, "Pardon me, Mr. and Mrs. Dr. X, whoever, could you tell me when I will be eligible for ground privileges? Yeah, when will I be able to go outside?" They did this as normally as possible. and the results they reported, we'll talk about it in class when we do evaluation. There's been a couple of questions raised about the procedure in the past couple of years for evaluation purposes. But when they asked this, 7% of the psychiatrists responded, 3.6% of the nurses. So really they just got ignored. And the majority of doctors and nurses just ignored patients' questions. So what they wanted to do was do a similar sort of thing on a university campus. So they got a female participant on a university campus, went up to strangers and asked them a couple of questions. Every single person stopped and answered the questions and made eye contact. Rosenhan concluded that the kind of relationship between doctors and patients in the hospitals was not a good one, as well as the idea of segregation, powerlessness, and not being able to tell sane from insane. So what we'll do is we'll expand on this a bit further in class, and we'll go a bit deeper with our understanding.